Hello, my name's Kaushik Ray, Professor of Public Health, Consultant at Imperial College London. I'd like to talk about our paper, which was in JACC Advance, and it basically covers data that we looked at in the CLEAR Outcomes trial. And the reason it's relevant for clinicians is that we know that bempedoic acid in the trials caused a small increase in the risk of gout, which basically was due to a competition between bempedoic acid and uric acid for a renal transporter. So uric acid is retained preferentially. And so clinicians, the question is, do I need to worry what happens if I have gout in a patient? And does that mean I shouldn't be using bempedoic acid? So the first thing is, people who have a history of gout derive similar cardiovascular benefits with bempedoic acid. So that's important. So we don't want to not use this treatment. And what we basically did was we broke the population down into those individuals with no history of gout and normal uric acid levels, or elevated uric acid levels at baseline, or a history of gout previously, or both. And what we found is that if you have high levels of uric acid, you're more likely in the placebo arm to experience gout. If you look at the randomized comparison between bempedoic acid and placebo, in people with normal uric acid levels or no history of gout, there was no difference between bempedoic acid and placebo in gout presentation during 2.5 years. We also observed that in people who had been previously treated, who've got a previous history of gout, and you're on allopurinol, for example, or probenecid or other agents, then the risk of gout in the trial between bempedoic acid and placebo is almost identical, it was matched. And then there were some patients who actually developed gout during the course of the trial, and they received uric acid lowering therapies, allopurinol or probenecid. And in those individuals, there was very little in the difference of gout occurring even in bempedoic acid treated patients. The clinical take-home message is you don't need to withhold bempedoic acid in people with a prior history of gout. What you basically want to do is, if there is a prior history, potentially treat them with allopurinol, which mitigates against the risk of gout. And if gout does occur during the course of your treatment, then you can give them things like allopurinol, which stops further gout episodes. So that really is the key take-home message for clinicians.